I am a firm believer in the power of storytelling, and we certainly have heard a lot of stories around here the last couple of days. And I'm going to tell you a short story, among many, about why I remained in the active ministry beyond my 80th birthday, and why I still continue to be involved in healthcare issues for marginalized people. And the story goes like this. I was in my office one day, and one of the social workers came, and she said, "Sister, will you come to my office and talk to this patient?" And I said, well, I guess I will. So I quickly asked what it was about as we walked down the hall together. I learned that the patient I was about to see had received services at Mercy Clinic, and she had been referred to a specialist for cancer treatment. The patient and family had worked very hard together to raise the funds that were needed for her treatment. And out of some grant money that we had at the clinic, we contributed an amount, and the rest was negotiated with the providers to cover the expenses. The patient's reason for the visit was to donate some money back to the clinic. It was close to Christmas time and the holidays, and I knew that the family could use the money. And we desperately tried to talk her out of giving this money back to the clinic. And we tried to help her understand that she didn't have to do that all the expenses had been covered, and she was in remission. And she looked at me, and she said in a very stern voice, "No, you don't understand." She said it to me in such a way that I really listened. And she said, and I quote, "I want to do this. I need to do this, because the next time someone is in my position, I want you to be able to help again." At this point, I realized it was not about the money. It was about the patient's dignity. It was about the patient's need to be involved in her own care of caring for others and giving something back. I am sure that in this gathering there are hundreds of stories that need to be told, stories that need to be heard. And the reason I say that is because, and I quote, "Stories have the power to engage the human brain's ability to translate abstract data into emotional, relatable narrative stories that shape our beliefs, drive our actions, and build trust in ways that facts and figures simply cannot." So I want to say thank you to Mercy for nominating me for this award, and thank you to CHA for honoring me with this award. Thank you all for listening to my story, and I want you to go out and be instruments of God's mercy and share your stories with your communities all over the country. Thank you.